Hello, YouTube world. This is Miss Patty from For Your CNA. Thanks for joining us. We are live here at Thursday on 3 for our live question and answer session for CNAs, instructors, those that are interested in the field, and those that are already working and have questions about where you can work and what you can do as a CNA. We're here to answer whatever questions you have. So we'll give everybody just a few minutes to filter in. When you get in, just give me a hi. Let me know that you're here. Give me a quick hi. Let me know you're here. All right. So as you guys know, I usually do like a little mini lesson, when we get started as people come in. So one of what I want to talk to you about today is on one of my videos, I got this question this week, and I thought it was a really good question to kind of kick off our question and answer session today. So Emily B asked, if you failed the skills exam, do you get the same skills the second time around? And the answer to that is usually no. So let me explain how this works, okay? So let me see here. Where's my... All right, you guys have seen this before. We've talked about this. So remember this. This is our skills, the care plans that you would get for the state exam. So when you go take your state test, they give you a sheet of paper like this that has 3 skills detailed on it, along with a care plan that tells you how to do those 3 skills. So we've talked about this before, right? So there are 11 care plan sets. So 11 sets of 3 skills each. You testing with Prometric will get 1 of these cards. So 11 cards, you're going to get 1. And you're going to do those 3 skills that are on the card. So remember, there's 11 cards, 11 care plan sets for the test. So when you go take your test, when you register with Prometric, Prometric gives you an ID number. So coded in that ID number is the skill set that you're going to be getting. Okay. So in that ID number, it may have that you have skill set 4 or skill set 7 or skill set 10. It will, that number tells the evaluators what skill set you get. And it's important that you know that the evaluators do not choose your skills. The computer chooses them way back when you register. So this is already set in place long before you get to the test. Now, in that number, it also codes in the second, if you have to retake it, what your second skill set will be, and even what your third would be. So this is all kind of done on the back end when you register. It's all done through the computer. The evaluators have no say in this at all. So it's important that you know that. But when you look at these care plan sets, I know my video is backwards right now, but when you look at these care plan sets, right? So let's say perform passive range of motion to elbow and wrist, which is a second skill. This skill might actually be on another care plan set, right? So even though you get a different care plan set for the second skill set, you may still have one of the skills from your first skill on there. So it's not quite a yes or no answer. So the question is, for those of you just joining, if you fail the skills test, when you retake it, do you perform the same 3 skills? And the answer to that is no, you won't have the same 3 skills, but you may have one or more of the skills from your first card on another card as well. These sets are predetermined by Prometric. This is all set in place by Prometric, way in the back end. You'll never see it. You'll never know about it. These care plan sets are actually in my skills book on page 17. So if you have my book, this book, so those of you that have this book, on page, I think it's 17 or 19. Let me look it up. Let me give you the right information. Hold on. Yeah, page 17. So here you have all the 11 care plan sets and what's on each one. So you can see like measure and record respirations. It's on, I think it's 5 different care plan sets. So if on your first attempt you got measure and record respirations, that skill may be on another care plan set as well because they're on 5. So, or four or 5. So it is possible that you may have an overlap of 1 or 2 skills. So I hope that helps you guys. But it's not, it won't be the exact same care plan set that you had the first time around. So what does this mean for you? Well, it means that when you go take if you failed the test the first time, when you go take it the second time, you still don't know what skills you're going to get. And what a lot of people do, they get really kind of freaked out because, oh my gosh, I failed the first time. I can't fail again. So the 3 skills that they had, they go practice and they get really, really, really good at those 3 skills. And when they go retake the test, it's a totally different care plan set. And then they get all frustrated because, oh my gosh, I know those 3 skills, but I didn't practice these over here. And now I'm going to fail again. So it can really derail you. So when you go take the test, remember that the second time around, you're not going to have the same skills. So don't go home and practice those and perfect those and forget about all the other skills that you need to learn. But there's another reason why this becomes important. And a lot of times we lose sight of this fact. The whole reason that you're taking the test is to get certified. The whole reason that you're getting certified is to go to work. Now, we often forget about that part of it, right? We just take the classes, we watch the videos, we study, and we're going to go to the test. That's all you're thinking about is test. How do I pass this test? But remember, on the other side of that test is work with real people, real patients. And these are real skills. So if you're just studying to pass a test, you're not going to be effective when you get into the workplace because you didn't prepare for that. You're not ready for that. You're not thinking in those terms. You're just focused on the test. And a lot of times what ends up happening is that people that just focus on the test, when they get into a clinical setting, they fail. I mean, they wash out. They quit 2 weeks in, and this isn't for me. This isn't what I thought it was going to be. I don't like doing this. It's not what I thought, because they focus so much on the test that the real life scenario never became real to them. And that's a real danger here. So I want to take a minute just to focus you back on the fact that don't worry about whether you're going to have mouth care on the test. I mean, you might not. I don't know. I have no idea what skills you're going to get. But whether or not you have mouth care on the test really doesn't make any difference at all. It's, can you perform mouth care on somebody who can't do it for themselves? So you should be practicing all of these skills and getting them all down, not for the test, but you need to do this for the patient beyond the test, the one that you're really going to have to care for when you pass the test, when you go to work. And I've seen a lot of people that just focus all of their time and energy on learning things for the test. And then when it comes down to, okay, I'm certified now, and they know how to do it for the test. But when it comes to a clinical setting, they like, oh my gosh, I this isn't like the test. Well, no, it's not going to be, because every patient is different. Every place you go to work is different. Supplies are different. The amount of help the patient can give you is different. What the patient prefers is different. So remember that when you're practicing for the test, it is one patient, one scenario. You've got a specific amount of supplies. It's all laid out for you, but that is just one. So let me give you kind of an example to put this into perspective. Think of three people in your family, whether they're brothers or sisters, mom or grandma, aunts, uncles, nieces, nephews. Think of three people in your family. And I want you to think about, are they exactly alike? All three of those people. Do they brush their teeth exactly the same way at the same time? Do they wear the same types of clothing? Do they like the same foods? Do they eat at the same times? Do they comb their hair the same way? Do they all wash their hair on the exact same days? Do they all go to the same place every single day? Or does one go to school, one goes to work, one stays home? Remember that everybody is different. Everybody is an individual. And if you're learning mouth care and you're only learning one, that this is it, this is the way I'm going to do mouth care on every person from here on out forever and ever, that's just simply not true, because every patient is different. And that's why we have those care plans, because those care plans as CNAs help us look at that patient and look at the care plan, and it's going to help us figure out how to take that task and apply it to this patient based on the needs and preferences of that patient. So that care plan really is our instruction manual, and we have to follow it exactly. So if you are just, okay, this is how you do mouth care, you do this, 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 and I'm done. It doesn't always work out like that in real life. So you need to have that ability to learn how to adapt, and to understand that in a clinical setting, life isn't always exactly like the test. And if all you're doing is preparing for the test, you kind of miss the point. So when I'm looking at questions like this from Emily, it's a great question, Emily, and one I get a lot. So when I'm looking at a question like this, it gives me an opportunity to remind you to refocus back on what we're there for to begin with. It's not range of motion. It's not respirations. It's not ambulating. It's not feeding. It's doing these skills on the patients that need them done. And you've got to make that leap. So in reality, it doesn't matter what skills they give you for the test. You've got to know how to do all of them. And you've got to be able to turn that quick, because the patient over here that you're supposed to do mouth care on may have to wait a minute because you've got to go over here. You got to change in a second to go over here and help this patient onto a bedpan because they simply can't wait. So remember that it's not all cut and dried. You do these three skills in this order. So in a clinical setting, remember that we have to be able to adapt as well. So I hope that that kind of helps you understand the differences between the test and a workplace. And yes, the test is important. We have to pass it to get to the workplace. But don't forget that that truly is the end goal. The test is not the end. The test is merely the beginning, actually. It allows us to get into that workplace. So when you're practicing those skills, don't practice it for the test. Remember, that's step one. The test is the beginning, not the end. You need to be practicing those skills for the patients you're going to take care of. I hope that helped you guys and helps you kind of refocus on what we have to think about when we're going into the test. But in most cases, the skills that you had the first time around will not be the same skills that you get the second time around. There may be one in there that is the same, but for the most part, it's going to be a different skill set. It doesn't mean that you shouldn't learn the ones that you failed to begin with. It's probably important that you go back and review those, because I might be the body in the bed one day. You may walk in a room one day and it's me that you have to do mouth care on. I'm getting older, guys. I'm going to need medical care at some point. You may be doing these skills on me, and I want to make sure that you're doing them correctly so that I don't end up injured or exposed or something like that. So if you fail a skill on the test, Make sure that you learn it, not for the test, but for the patient beyond the test. I hope that helps, guys. Let's see who's here. Henry Edline? Edline? Hi, Henry. Gloria says hi. Hi, Gloria. Thanks for joining us today. Ramses, hello. Nice of you to join us again. Daru says, I'm hoping I say that right. Daru says, hi, I'm new here. Well, welcome. We're so happy you decided to join us today. Teresa says, how do you get the book? Oh, that's a great question, Teresa. So I'm going to put this in the chat here just so you guys can see it. So, oops. Okay, so if you go there, courses.foryourcna.com shop, or you can just go to my main website, that's foryourcna.com, and click on shop. Both places will get you where you need to go. But in that shop is my book. The book is $38. If you're in Florida, Uncle Sam's going to charge you sales tax. And then there's a shipping charge as well. But that book is very, very helpful. It covers everything, theory and skills. And it explains the test as well. It has a practice test in there too. That's different from the practice test on my website. You guys know I have a practice test on the website, right? The practice test in the book is different questions. Mary Booberry. Hi, that's an awesome name. Hi, Miss Patty. I'm loving my new job in the CV-ICU. 3 weeks in. Oh, that is incredible. I love cardiac. So CV-ICU, for those of you that don't know, stands for cardiovascular, which means heart, intensive care units. So CV-ICU are going to care for patients that either are recovering from heart surgery or maybe have had a recent heart attack or are getting ready to have a heart procedure. So I absolutely love cardiac nursing. I actually worked in a doctor's office for a while, for about 4 years, and he had been a cardiovascular physician at one time, and then he switched over to general internal medicine. So he taught me a lot, and I'm very, very thankful for the time I got to spend with him, because I really, truly got an education in how the whole cardiovascular system works and how it affects other systems as well. So Mary says, never worked in a hospital before. I've already floated to the PCU, and that was fun too. Thanks for your help. That's awesome. Anytime you have an opportunity to float around, do. Think of floating. I always looked at like working in a pool. A lot of people, so let me explain what this means. So a lot of people in healthcare, especially if you're brand new to healthcare, you'll probably be offered a position in the pool. Now, the pool, it's not like a swimming pool. What that means is you're not assigned to any one particular unit or floor. You are in a group of people that they can pull from and send anywhere to fill in positions when your normal, regular person that takes that position is not there. So if you get in a float pool, that is your best opportunity to be able to see all different types of departments in the hospital and figure out where you fit. So for instance, I am not a labor and delivery nurse. I do not like, now I love watching babies born. I mean, I'll cry every day when I see a baby being born. It's a beautiful experience, but that's not really the thing for me. It's just not, a bunch of screaming women and men that are nervous, and sometimes 2 baby daddies show up. So it's a lot like Peyton Place. I mean, it's just not really my thing. But I've got a very, very good friend that started her career in the mother baby unit, absolutely loved it, and went on to be a NICU nurse, a neonatal intensive care nurse. And she absolutely loves that. So everybody's journey is a little bit different. But if I had not had the opportunity to try that out, being in a float pool, and realize that, oh no, this is not for me, not my cup of tea. Give me a trauma any day of the week. I like trauma. I like cardiovascular. I like ICU, and I like hospice too. But you really being in that PRN or float pool position gives you an opportunity to kind of try all different types of units out to figure out where you fit the best. And believe it or not, you don't fit everywhere. You kind of have to figure out what you like and what you don't. Now, I've got a really cool quiz on my website, healthcare quiz on foryourcna.com. Let me put this in here for you. If you go on there, right in the middle of the first page, I've got, a link to the healthcare quiz. It's also in the top menu too under training. And it'll kind of give you an idea of, based on your answers, where you might think about working, where you might belong based on your interests. But Mary, I'm so glad that we were able to be part of your journey, and we're super excited for you. Keep getting those experiences, and I'm sure that you will fall in love with it as well. And I'm so happy you're having a positive experience in your CV-ICU. Beauty by Nicole says, how many skills do we have to pass the exam? Okay, Beauty, it's 3. So you're going to get 3 skills to perform. You have to pass all 3. I mean, can you imagine for a second? Let's just kind of think this through real quick. Remember, our end goal is the patient on the other side of the test, right? So can you imagine you take a test, you only have to pass 2 out of 3, and you fail bedpan. Okay, it's a skill you failed, but they still pass you. You're still a CNA. You got to work somewhere. And somebody, the very first patient that you get has to use a bedpan, and you go, sorry, I can't help you. I failed that skill on the test. I don't know how to do that. Well, your patient can't wait. I mean, when they got to use a bedpan, they got to use a bedpan. So they can't wait for you to rustle up somebody that can do it. So that's why for the test, I know it seems very, very daunting, right? I have to pass all 3. Yeah, you do, because your patients on the other side of that test really need you to be able to perform all of the skills that we could be tested on. And you got to be able to perform them well, because that patient is going to need that from you. Sure, there's a learning curve. Absolutely. Anytime you get hired anywhere, I don't care whether it's 7-Eleven, Walmart, Chili's, or the hospital, there's always a learning curve, right? An orientation period where they're going to show you around, you get paired up with another person, they precept you, they kind of help you learn the ropes, and you'll kind of learn as you go as well. But you still have to come in with a certain level of skill, right? So even though you're going to kind of learn in orientation, this is how they do things here, you kind of need to know how the skills are done as a baseline and then be able to adapt to that setting. So yeah, you do need to know all 3 skills. You have to pass all 3 skills. And Blue asks, how many mistakes can one make on the skills exam before it's considered failing? So this is a bit complex. Okay, so I'm going to try to make this simple as possible. There is no set number. I can't tell you you can miss 3 things on each skill and still pass. It doesn't work like that. So here's the example I give in my classroom. Let's talk about a patient who's laying in bed and we have to brush their teeth. Now, is laying down a safe position for us to brush somebody's teeth? What do you guys think? Is laying down a safe position? Go ahead and type your response in. Do you guys think laying down is a safe position to brush teeth? Anybody there? No. Okay. Very good. Very good. So no, it's not a safe position to brush somebody's teeth. And if you try to brush somebody's teeth and they're laying down, they could potentially choke. And that can cause serious health problems or even death, right? So we know that it's probably pretty important for them to put the patient's head upright. Now, whether you put the head of the bed up, whether you get them to sit on the side of the bed, whether you get them to the bathroom so they're sitting over the sink, doesn't matter. But we know that they need to be in an upright position before we brush our teeth. That's a pretty important checkpoint. Now, When you're brushing somebody's teeth and they're not standing over a sink, they're probably going to drip all over their chest area. I mean, that's just the way it is, right? When you're standing over a sink, you're kind of standing like this, so everything falls into the sink. When you're sitting in bed, you're sitting like this, so everything's going to fall down here. So putting a towel on somebody's chest can certainly help keep their clothing clean. And that would be somewhat important if it's me laying in bed, because I don't want to walk around or sit in a wheelchair all day with toothpaste all over my clothes. I like to look nice. So even though, it's kind of important to me, it's not going to kill me if I get toothpaste on my clothes. But not putting my head up could kill me. So understand that these are not the same, right? Not putting the head of the bed up, that is going to count a whole lot more. It's going to be weighted more than putting a towel on somebody's chest, because we want things that are more important, things that could potentially impact the patient, to count more than little things. So you might be able to miss a couple of little things and be perfectly okay and still pass the test, but you miss one big thing and you fail. Does that make sense? So each step on the checklist is weighted. Now, you don't know what the weights are. I don't even know what the weights are. They're going to have different weights to them, and that's something internally at Prometric that they do. And they don't release that information, but understand each step is going to have a different weight to it based on how important it is to the well-being and safety of the patient. So some things won't count a lot. Some things are critical steps that would fail you if you forgot that one step. So for instance, let's say I'm going to brush your teeth at home, and I get everything ready and I put my toothpaste on my toothbrush and I come up to you and I don't have gloves on and I ask you to open wide. Do you want my hands that have touched everything in this clinical setting in your mouth for me to brush your teeth? Probably not, because everything I've touched, I now have those work germs on my hands, and you don't want those in your mouth. That's really icky. So remember that, trying to brush somebody's teeth without gloves, that's an automatic fail, because it impacts the well-being and safety of the patient. Okay. Not putting enough toothpaste on the toothbrush, it doesn't really impact anybody. It's fine. So you might get a ding on it, but it's not going to cause you to fail the test. Remember that everything involved in the test has to do with the patient. So everything you're being graded on, the evaluators are paying attention to that patient. How does it impact the patient? Is the patient safe? Are they comfortable? Do they understand what you're doing? Everything is centered on the patient. Now, if you are also centered on the patient, you'll do fine on the state exam. Okay, I hope that helps. Gloria says it's a snow day here in Dallas, Texas. Good to see you. Oh, thanks, Gloria. Yeah, I know the Midwest is getting hammered, man. Snow and sleet and ice. And here in Florida, we're getting ready to go on our swimming pool. It is warm. We love it. It was cold this weekend, though. I do have to say that. Solomon Esther says, I'm so happy to join this class. Well, we're happy to have you. Kimberly says, hello, good day. Hope you are well and have had a great week so far. I have, Kimberly. Thank you so much. That is super sweet. I hope you also have a great week. And yes, I've had a fantastic week so far as well. See here. Teresa says, thanks for the info. Does the book cover Virginia laws for testing? I'm a caregiver now. I've been doing this for a long time, and this is a passion of mine. Well, Teresa, the book covers Prometric specifically. Okay. So Prometric tests in 14 tests. Virginia is not one of those. I think Virginia, if I'm not mistaken, has Pearson. If you go onto my website, I have a map on there that actually shows, if you click on your state, it'll show you your testing provider. It'll also link you right over to like, if you click on Virginia and then click on the testing provider, it takes you right to their website. And all of their testing information is right there. So that would be a really good way for you to find out. But the book, going back to the book, even though it covers prometric testing specifically. So when I say that, I mean these are the testing or the testing care plans for prometric. Virginia does not use prometric. I'm not real sure. I think they're Pearson, but even though the care plans will not be the same, the principles that are in the book are. So if you're testing in New York, North Carolina, Wyoming, California, Florida, Georgia, insert name of state here, all washing skills have to be done the same way. You have to check the water. The patient has to check the water. Whatever you wash, you rinse. Whatever you rinse, you dry. Try not to get your surface wet, whether it's the bed, the table, the floor, whatever you're working on. If you're going to put lotion on, make sure you warm it up first, wipe off the excess. Don't add soap to the basin that you're using, because then you don't have rinse water. Remember, whatever we wash, we rinse. So basins are no soap zones. So all of that is universal. It doesn't matter what state you're in. Those rules still apply, and they're going to be tested on the testing checklists. So the book works no matter what state you're in. It's just that the testing care plans will be specific for prometric testing states. Okay, that's the only thing that's specific in there. Everything else is principles. So all of the skills are demonstrated. Everything else are principles that are based on basic nursing practices. Okay. So it will work in any other state. Now, there are a couple exceptions to this. Okay. So the book does work nationwide, no problem. But there are a few exceptions to this. Some states, not prometric, but some states still require the use of side rails. Now, this is kind of an outdated idea, and side rails are being removed from most testing parameters moving forward. But right now, there are some states that still require side rails during testing. Prometric does not. So my book won't, you won't see that in the skills steps because we don't use side rails. If your state does, then you want to add those in. Okay. Hope that helps. So let's see here. And we wish you luck, Teresa. Natalie says, Miss Pat, I would like to say thank you for your videos. They really helped me. I'm happy that you passed your state exam yesterday. Yay! Congratulations. Welcome to healthcare. That is awesome. Awesome job. That's sweet. I'm proud to tell everyone you're the best instructor. Thank you so much. You're so sweet. Queen Stella says, hello, I'm enjoying all you're saying. Oh, thank you. I appreciate that. Jeanette says, good evening, everyone. Hi, Jeanette. Carmelane says, good evening. I got 4 years. I went 3 times to get my test. I did pass the skills, but I did not pass the written. What do you want me to do, please? Okay, Carmelane, I'm a little, I'm not understanding all of what you said. You've got 4 years, 3 times. So, and I don't know what state you're in. So this does vary state by state, but generally speaking, most states have 3 attempts in 2 years. So if you've done 3 attempts in 4 years, you probably are okay to retest. So I'm not entirely sure here, but if you're eligible to retest, you need to make sure, okay, if you're eligible to retest for the written, you need to go onto my website and watch the animated lessons. So on my website, I actually have skills videos, which most of you guys are familiar with. Most of you find me through my skills videos. I've got skills videos, and that's what most people focus on. But I also have animated lessons. Now, the skills videos focus on skills, right? The animated lessons are going to focus on topics that are relevant to the written test. So you'll want to head over there and watch my animated videos, and I'm sure that they'll help you with the written portion of the exam. But there's something called the 5 principles, and you have to truly understand this to be able to pass the written test. So we call them the 5 key principles. I actually have a banner. I don't know where, I don't have it available to me right now. But if you go onto my website under shop, you can see the banner for the 5 key principles. The first thing you need to know, it's the care plan, the whole care plan, and nothing but the care plan. That's it. Care plan, whole care plan, nothing but the care plan. We don't do anything if it's not on the care plan. The second thing you need to know is that CNAs do normal principles guide performance. So you know what I just told you guys about the washing rules, right? Whatever we wash, we rinse. Whatever we rinse, we dry. Don't get the surface wet. Basins are no soap zones. Remember all that I just told you? Those are principles. And we have 11 principles to learn. They're on page 19 of the book. They're talked about throughout the book, but I've also got a whole bunch of videos on them in the animated lessons. They'll help you. So principles guide performance. We have to remember that it's always about the patient. If you focus on the patient, you'll be okay. And then anything, any observation gets reported to the nurse. So there's the 5 things you need to know. If you understand those 5 things in detail, you'll be okay on the state exam. Okay. I also, two lives ago, I dissected written test questions. So go watch that one from 2 weeks ago. It'll help you with that as well. Okay. Let's see here. Share, Melvisuka Saka. You're new here. Well, welcome. Jeanette says very interesting lessons. Greetings from the British Virgin Islands. Oh, how exciting. I would love to be in the Virgin Islands. I am a tropical girl for sure. Let's see. I'm so happy to join the class today. Worry Girl says, I've been following all your teachings for 2 months now. Thank you so much for your time. I passed my nursing assistant exams in school. Now I'll be writing my CNA exams on the 25th of this month. Oh, that's so exciting. We're so happy for you. We are sending out good vibes and you're going to do fantastic. But thank you for making us part of your journey. I love that. So let's see here. Blue said, oh, Miss Patty, Washington State is weird. Side rails is tested, but it's confusing if you don't understand the rules because of how or when you use side rails depends on the rules. And that's absolutely right, Blue. A lot of states still have, they're in that transition period. Now, Florida is not testing on side rails. No Prometric state is, but other states are still in that kind of murky transition period. So you do have to know the rules. Let's see here. Teresa's going to go look on my page. And Kanisha says, where can I find the practice written test? Go onto my main website, foryourcna.com. Let me type it in for you again. foryourcna.com. Go onto my main website under training. Okay, so I've got training, testing, after certification. Under training, click on that and a drop-down menu comes up. Practice test is on there. Go ahead and take that practice test. It'll help you. Blue says, if you're in a hospital setting, care facility, how old the patient is, and if it's a person's home. Yeah, those are all of the parameters for side rails. Yes, absolutely. I know, Blue. I had to turn on slow feed on the comments just because I'd had a couple of trolls in here. So we'll try it next week without that slow feed. Hopefully, we'll do a little bit better. And that way, when you're putting in comments, they're not so separated. So yeah, I'm sorry about that, Blue. Let's see here. Amarachi says, hi. Let's see here. I've been following your video for 2 months now, passed my mock exam, waiting for my certificate. Thank you. I'm very grateful. Melvis from UAE. Oh, that's amazing. And our audience is getting further and further out, and we're so excited to welcome everybody to our channel. Emanuela says, hi, Miss Patty. Your videos have been so helpful. How do I get a job after passing these tests and exams? Oh, that's easy. Everywhere is hiring. Everywhere. Go look around your local community. Look at hospitals, nursing homes, assisted living facilities, rehab centers, same-day surgery centers, walk-in clinics, mental health centers. The list goes on, and they're all hiring. A lot of them have sign-on bonuses. We are so short-staffed right now. It's not even funny. We were already short staffed before COVID hit, and then we lost about a third of our workforce. So if you have a certification and you're breathing, you will be hired. I guarantee it. We need workers. So just start networking, look around your local community for facilities. You can look on different job search boards, but the best thing to do is to go onto each website. Like if I wanted to go to work in my local community, I would look at the websites for my hospitals, the nursing homes. And I actually did this on my website under after certification. You can see local employers. I did this for my own students locally. So everything is in that page for my local community, but it'll kind of give you an idea of what different categories you can look under for employment in your community as well. So let's see here. Jeanette says, I'm in the process of completing my PCT course, and these videos are really helping me. Oh, thank you, Jeanette. I really appreciate it. Thank you for letting us be part of your journey. Kimberly says, I did your video with the skills and all the rest. I did very well and passed. It was not only education, it was fun. Oh, thank you, Kimberly. I love to get feedback on that. Thank you. Guys, I don't have a team of people to do this. It's all me. I poured my heart and soul into that online course and the videos that I do. And I love it. It's so much fun. It's so creative. And I love being able to share my passion with everybody. But I do like to get feedback too. If there's things you don't like, please let me know. So the next time that I do videos, I know what to change. So let's see here. Zaire says, I was so stressed about blood pressure skills, even though I know how to do it. I'm glad it's not on the clinical skills. Yeah, Prometric does not test on blood pressure. And Blue says, are gait belts a thing in Florida? And how do you teach the use of one? Yes, absolutely they are. And if you watch my ambulate with a gait belt and transfer from bed to wheelchair, it'll tell you how to work a gait belt. But in my online course, I have my whole classroom lecture on gait belts. I think I talked 45 minutes about gait belts in there. Mary says, my sign-on bonus was $1,500 in Arizona. Yeah, that's awesome, isn't it? Nice. So Blue says, if you have a CNA license in my area and nothing weird shows up, you can pretty much pick the hours, days you want. Yeah, they're so desperate, especially in home care. Remember, home care is the fastest growing segment of healthcare in the nation, because in home care, you can only, it's one CNA to one patient, maybe two if you're husband and wife team, but one CNA, you can only be in one home at a time. You can't be in 3 homes at a time, right? But so you're limited. So every patient has to have a CNA. In a clinical setting, you can have one CNA for 15 patients or 20 patients. So home care, because we have to have one for every patient, there's a whole lot more demand. So if you are unsure what type of work environment you might be comfortable in, I would urge you to consider home care. It is the fastest growing segment of healthcare. It is also the one that's most underserved as well. And guys, I can tell you with absolute certainty, if I get sick, I don't want to be in a facility. I want to be in my home, right? When you get sick, where's the one place in the world you want to be? Home. So I get it. I understand where these patients are coming from. And we need to have workers that are willing to help these patients in their home to keep them out of facilities. They just tend to do way, way, way better. And Joy asks, do CNAs take vital signs? Yes, they do. So let's get to, I'm running a little late, guys. Let's get to congratulating the people this week that let me know that they passed. And if you have taken the state exam recently and you passed, we want to congratulate you too. So just stop by any one of my videos, drop a comment in there, not a reply to somebody else's comments, because I don't always see those, but drop a comment and just say, hey, I passed. That way we can congratulate you too next week. So the people that passed this week is along with the ones that have already let us know on here. Ashlyn Kaplan, congratulations. You are now a CNA. Lafem Noor, also congratulations to you. We're super proud. TA also passed the state exam this week. And Love Being Natural pass the CNA exam this week. So we are super proud of all of you guys. You did a fantastic job. Welcome to the wonderful world of healthcare. Remember, we're never going to get out of this shortage unless you guys do your part in recruiting other people with good hearts into healthcare. So instead of focusing on the negative and complaining to everybody about how horrible your job is, understand it's never going to get better unless we're actively bringing people into the industry. And nobody's going to want to enter an industry when somebody's complaining about it all the time, right? So make sure when you're telling other people that you try to remain positive and recruit them. Oh, you are such a caring person. You'd be great in healthcare. You want to think about this as a career. And that way we can, because guys, if we get more people into the industry, now we're not working short-staffed and the job is what we want it to be. But we're never going to get there unless we do our part and bring new people in, right? So try to keep that in mind this week. So testing coming up, Sama is testing on 2/8. So we're going to push out some good vibes and hope that they are successful. So thanks for joining me this week, guys. I really enjoyed this. And oh, thank you, Blue. Blue says, thank you so much. I really enjoy spending my Thursday afternoons with you. And if that you have any other questions, please feel free to let me know. We'll be here same time, same place next week, Thursdays at 3 Eastern time. And I look forward to seeing you and answering your questions about CNA. So guys, until next time, happy caregiving. Bye.